if we don't get in control, it will control us, right? Hey everyone. So we already know how many people feel stuck in the limitations of conventional medicine, and that's exactly why I created Holistic Health with Melissa, to take you on a journey from conventional to crunchy. Here you'll get empowering wellness insights, practical tips, and faith-centered strategies to help you feel your absolute best. In each episode, we'll dig into what true health and wellness really means. We'll dive into nutrition, lifestyle, mindset, and detox, all things so important to your health. We'll chat about raising kids with intention and living life of faith. So join me to reclaim your energy, embrace your healthiest life, and find joy and purpose along the way. Welcome back to another episode of Holistic Health with Melissa, the journey from conventional to crunchy. Today we have an incredible guest joining us, someone whose journey just embodies resilience and transformation and a deep commitment to helping others heal. I am so excited for you to hear from her. Krissy Ford is a board-certified physician assistant with nearly 20 years of clinical practice. Following her own health struggles, including cervical cancer, IBS, and adrenal fatigue, she pivoted her practice to focus on functional health consulting and now helps high-achieving women uncover the root cause of their fatigue, brain fog, and gut dysfunction. With a specialty in IBS and adrenal dysfunction, Krissy helps clients understand the connection between the gut and the brain and how strengthening the axis through the nervous system regulation and personalized nutrition can heal the body both inside and out. Welcome, Krissy. I am so excited to have you here.
Thank you so much. That was a lovely introduction. I'm so excited to be here.
This is so right up my alley, nervous system regulation and yeah, the gut brain axis. It just like that is what just lights me up talking about the nervous system and how it is so beautiful, but can also hold us back. So if we don't get in control, it will control us, right?
100%. Yeah.
I'd love to know a little bit more about your like personal journey and what you went through and how you got to where you are now.
Sure. So I've been practicing as a traditional clinical provider since 2005, and I had it all, right? I had the two kids, the dog, the husband, the successful practice, and I was just chugging along. And in 2018, I got a call from my gynecologist, and she said, "You have cervical cancer." And it kind of blew my mind because I thought I was healthy. And as we all know, well, maybe not all, but cervical cancer, any kind of cancer, it doesn't matter sometimes how healthy you are. But at the time, it was sort of a shock to me, shock to my husband. And so we went forward with surgery. I had about 2 months later, I had a complete hysterectomy. I had 33 lymph nodes removed, and I did have to take about 8 weeks off of clinic time in order for my body to heal. So being a type A personality, I kind of did my healing. I started doing some nutrition stuff, but once I got the green light to go back to work and get back into life, I did. And I just started chugging along again, full clinic, raising the two kids. And I was, as far as the surgery side of things, I was healing, but I ended up having lymphadenopathy in the leg. So then I'm having to go to physical therapy. My gut started to act up. My sleep started to get affected. And I was noticing things that were outside of the realm of just this cervical cancer side of things. And so over the course of my recovery year after surgery, I was also diagnosed with IBS and adrenal fatigue because I was not allowing my body to actually heal internally, emotionally, mentally from the gigantic diagnosis and surgery that I had gone through. And I just kept trying to push through. And it was then and through that I realized I've got to stop. And if I don't stop, my body is going to shut down and my body is going to make me stop. And so that was really sort of my aha moment into really trying to pivot towards a more holistic lifestyle and really reevaluating what I was doing on a day-to-day basis.
Wow, what a scary like experience. I can only imagine how terrifying that must have been. Especially like coming from like the perspective you're like, well, I'm healthy. Like,
Yeah.
what? Wow. So when you say that's really when you started to embrace a holistic lifestyle and you understood that if you didn't stop, your body was going to make you stop, like how exactly did you start to embrace that lifestyle and make the changes?
I started to tap back into my undergraduate of nutrition, right? Nutrition, physiology, just kind of going back to the basics. And I started with nutrition. I started kind of, going to more organic eating. I started to try to cut out alcohol. I was drinking a little bit more because it was right when we were getting into all that COVID time period. And so my husband and I had been drinking a little more, so we cut back on that. We started to take out some of the unnecessary sugars and processed foods, not entirely, but that's really where I started. And then the more and more I started to read about and get into IBS and then how that was connected to your enteric nervous system and the gut brain connection, I really dove really deep into all of those connections between the gut and the brain. And it was through that I started to also realize that these were not individual things happening in my body and that these were all connected. So once I did realize the connection piece, that is when I started to also get into more of that stress management side of things and nervous system regulation piece of things.
Yeah, I love that you point that out because I think I've said this before, and I heard this from what is her name? I cannot remember her name right now. Dr. Casey Kitchen?
Means,
Casey Means, yes.
yeah,
I think her maiden name is Kitchen.
yeah.
Um, so yes, so she has said many times, actually, I've heard her say it, and I was like, man, that resonates so much, is that we have been like as traditional healthcare workers, like in our schooling and all through our like careers, we have been taught that the more hyper specialized you
Mhm.
are, the more prestigious and better you are. So like the she had said on a podcast at some point like the oto laryngologist or something, like somebody who focuses on literally like 2 square centimeters of the ear is actually like the most that was she was on that track, the most prestigious like type of doctor that you can be, when actually it's insane to think about that because like we've actually been like it's completely the opposite. Like when you're taking into account only this one tiny little area of the body, you're actually discounting the importance of the whole rest of the body, and your body is literally one system of interconnected parts. You cannot separate them. And when you separate them, then you get into a lot of trouble because then you try, start saying like, oh, well, you go to your cardiologist for this, you go to your
Mhm.
pulmonologist for this, you go to your neurologist for this. And all of those doctors don't talk to each other.
Mm-mm.
And they're going to
No.
put you on a pill here and a pill there and a pill there. And do those pills interact? And like, are they actually making things better? Or are they giving you other symptoms and other systems? So like I love that you bring that up because I feel so passionate and strong about that. Um, but I want you to talk more about what is the gut brain axis? Like you've said that already, and like what
Mhm.
does that mean and why is it so crucial for our overall health?
So the vagus nerve is a nerve that connects the brain to the enteric nervous system. The enteric nervous system is basically this collection of nerves that wraps around your entire gut from your esophagus down to your essentially your anus. And there is communication between the two. And what I think a lot of people don't understand, or maybe not understand, they just don't appreciate it, is that about 90% of, like, for instance, your serotonin is produced in your gut. And serotonin is our feel-good hormone. And that makes us happy. That helps to stave off anxiety. It helps to stave off depression. So your gut has to be able to be functioning correctly in order for it to be able to produce serotonin and these neurotransmitters in order to keep you feeling happy. But it's not even just that. There is the motility side of things. And so there is a migrating motor complex that helps move food through your gut system. And that is also controlled by not only muscle, but nerves. So there's so much related to the proper functioning of your gut. And when you don't have a gut that can properly absorb nutrients, when you don't have a gut that can properly make these hormones, it will directly impact your mood. It will directly impact the serotonin production. It'll directly impact your other hormones that are being produced.
Immune
And
system, right?
the immune system. And
Yeah.
so what I think a lot of times too is that a lot of times people don't get that some of the symptoms of, like, a disconnected gut to brain access is going to be things like irritability, things like mood swings, things like poor sleep. You're also going to have poor digestion. You're going to not have a normal appetite. There's a lot of things that are almost what we would consider vague symptoms that we can't quite put, our a nail on the head, so to speak, and say, okay, this is from this. When we oftentimes get people coming in, it is these vague symptoms of bloating, and I just don't feel like myself, and I'm not eating right, and I'm not sleeping right. And so there's all these vague symptoms, but they are all related to the health of our gut lining. And when our gut lining is not functioning correctly, when it's inflamed, those signals, those hormones can't get back up to the brain to tell everything else in the body how it can properly function.
Yeah, I feel like every symptom in my clients, what I see overwhelmingly is like all any symptom really that anybody comes to me with that I'm like, okay, well, like your gut sounds like it's a wreck, like all of the, like you're saying, like all of these vague symptoms, the pervasive chronic symptoms that we see across our culture right now, the weight, inability to lose weight, the
Mm-hmm.
fatigue, the sleep disturbances, the anxiety and depression, all of those symptoms where, like, talk to me. I was just going to say something about like traditional approaches to those versus, you know, our functional approach to them. Talk to me about that. Like, how is the functional approach different from the traditional approach of treating those symptoms and the conditions that like, or that you are specialize in, like IBS and adrenal fatigue? How do those two schools of thought differ?
Well, what's actually interesting about that is people who have adrenal, or excuse me, IBS are actually about 60% higher chance of also having a gut-brain disconnection, depression, anxiety, and they are intimately related in that respect. So when we are looking at someone, if you were to go into your primary care physician and you say, I've got bloating, that doctor is probably going to say, okay, take some Gas X, you're not drinking enough water, to eat more fiber. And the person goes home and they do these things and their bloating gets worse, or they don't feel any better, right? Because they're still not sleeping well. They're still, just trying to get through their day, get through their work. They don't feel well. They're downing their bodies with caffeine. And so the picture as a whole is not really being a true picture of what they need to be fixing. It's not just Gas X that you need to take to help your bloating, period, right? Same thing with anxiety or depression. It is a Band-Aid approach oftentimes where they're like, okay, you need to, take an anti-anxiety med or an anti-depression med. And when we're just trying to throw meds at things, which is more of that traditional way to treat, or the way that we kind of grew up, going through medical school, it is a problem-focused way to treat the body. We are missing so much more that will get our patients better faster and that will heal them quicker when we're just looking at, a blanket of, oh, you need an antidepressant. We're missing the whole other aspect of lifestyle modification, of, trying to make sure you're moving your body every day, of taking times throughout your day where you're just stopping, taking a break, and just not thinking about anything for 5 or 10 minutes. And so I think that the beauty of functional medicine is when we do look at everything as a whole, we are looking at the whole puzzle. And if there's one little puzzle piece that's missing, everything else can really get thrown off. And so it is really trying to listen to the client and put these pieces together, look at the functional medicine lab testing even. I know we do a lot of different types of lab testing that is not commonplace in our normal traditional clinical medicine. But for me, as somebody who was in medicine for 20 years and looking at white blood counts and red blood counts and liver function, the type of labs I check now have nothing to do with those. It's about, what does your gut health look like? What does your microbiome look like? Are you detoxing well enough? Are your hormones looking normal? What does your cortisol curve look like? These are things that we never really were taught so much in that traditional setting to be able to help these people on a grander scale.
Yeah, I think the gut microbiome, that's something that just absolutely like blew my mind when I learned more about that. Like I remember being a nurse. I worked, my first job was in the pediatric ICU at a trauma center. And I remember having a child, uh, a patient, as who had leaky gut. And I remember the way that they treated that leaky gut in the pediatric. It was actually, I was floating over to the step down and that he wasn't in the
Mm-hmm.
ICU at that time, but just in that traditional environment is completely different. And at that time, that was 15-ish maybe years ago.
Yeah.
I didn't, or more maybe. Yeah, yeah, it was like 15 years ago. I didn't even realize I had no idea the importance of the gut microbiome. And they never talked about it. They
Mm-mm.
never talked about it. I didn't learn it in nursing school. I didn't learn
Mm-mm.
it clinically. We didn't treat it clinically. It's just wild. Um, you said you threw a stat out there. IBS, people who suffer with IBS are 60 times more likely to have gut-brain dysfunction. How does somebody know when there is these like vague symptoms of fatigue, I don't feel good, I have bloating? How does somebody know that they have gut-brain dysfunction?
Well, I think that some of the first things that I work with my clients on is just trying to step back and work on getting your foundations better, right? Getting sort of the basics better. And I'm talking specifically about sleep, making sure you are eating well. When we say eating well, you trying to use whole ingredients, right? One ingredient would be eggs. There's not like eggs and salt, and there's not multiple things, right? So we're talking about whole foods, not eating a lot of the garbagey kind of foods that are in the middle aisles of the grocery store, but just trying to get the basics down first. Even if you try those basics for 4 weeks, going out, trying to get outside for at least 15, 20 minutes a day, trying to move your body, whether that's walking, yoga, any of those types of things. Just trying to do some basic things in order to see how your body responds. If after 3, 4 weeks, if you're still, you're having trouble with sleep, you're waking up at 3 a.m. in the middle of the night, you have chronic bloating that you really can't place that is going with any particular food source, for instance, those types of things, if they are persistent, then to me, the next best step is to get something checked in a more of a functional lab way. So find your local provider, reach out to somebody, who you trust online, but essentially looking at some of these labs that are a little bit more outside of the box, right? And one thing that I almost always do on my clients is a adrenal stress profile, where it's just kind of 24-hour urine, where you're looking over the course of 24 hours to see how your adrenal stress curve actually goes, which it should have a normal height in the morning and then dip as the evening goes on. And then the other thing I most often do is the GI map test, which is going to look at the microbiome. It's going to, I think when people hear about the microbiome test, they are thinking it's just the bacteria, just the microbiome. And what maybe they don't appreciate is we can see if there's inflammation in the body. We can see if there is trouble with detox. We can see if there is issues with your pancreatic enzymes being, able to help to digest foods. So for me, like I was commenting, I think the trying to just do some basic foundations, trying to make sure you're sleeping well, trying to make sure you're drinking plenty of water, you're moving your body every day, eating whole foods. If you're doing those things, you're still not improving, then step two to me would be to get in touch with a functional provider and get some labs done.
Yeah, I totally agree with that. Um, you talked about a moment ago about how you said that even just like taking a few minutes and like breathing and not thinking about anything, I see that as probably I go back and forth between that and nutrition. On any given day, sometimes I feel differently. And like sometimes it's, but the idea to me of when I'm talking to clients, what I see over and over and over again, the idea of sitting and thinking about nothing is virtually impossible for
Mm-hmm.
people. People, by and large, do not know how to do that anymore.
Mm-hmm.
We have
Mm-hmm.
completely gotten away in this technology driven age that we live in the age with all of these notifications and this constant stimulation. Like we just literally can't do it. And I feel
Mm-hmm.
like that is such an important piece. So I wanted you to touch on that a little bit, just about like, how do you sit there for 5 minutes if you feel like it's impossible? And like how that like nervous system regulation, that awareness, that breathing can actually play a role in strengthening that gut brain connection.
I'm so glad you brought this up because out of the clients that I've worked with, it's almost easier for them to just, get on this nutrition. They can like hit their checkpoints on the nutrition. They'll hit their checkpoints on, okay, I did 8,000 steps today, or, I did my yoga session or what have you. The hardest thing 100% of the time is the mindset piece and is the nervous system regulation piece. And I often wonder, like, is it because of what you said as far as like all the dings and pings and we have trained our brains to be so reactive to our surroundings that we don't know how to shut it off? Or is it that we don't know how to do it? Or is it that we feel like it doesn't matter? I sometimes think that, my clients will be like, okay, I'm doing all the nutrition, I'm doing this, I'm doing that. And I'm like, yes, but have you done your legs up the wall today? Or have you, go out and had your cup of coffee outside on your back porch without music playing, without, a podcast going? And well, they're like, no, 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 I didn't get to that. And what's funny is even 5 minutes or 10 minutes, which is not a lot of time in the grand scheme of our day, is such a small piece. And yet so many people, like, they just push it to the back burner. So oftentimes my sort of recommendation for this is if you could get an app. And I know that an app would be seemingly counterintuitive to what we're saying, but there are specific apps that the sole focus is to have just kind of brain waves or walk you through a meditation. One of my favorite apps is Calm, Calm, and that is, I believe you can get that for free. You can get, all of these apps have like paid versions as well, but you can just say, okay, I've got 5 minutes on the porch before the kids wake up, or, find a quiet space in your home and pick a 5 minute meditation that's on there. And meditation does not, I think meditation might scare people sometimes as well. And because they may not know exactly how do I meditate. It actually doesn't have to be that complicated. And even in some of these apps, instead of like a true meditation, sometimes it's just brain waves, like theta brain waves, and even Amazon has this, Amazon Prime or Amazon Music has this, where you can just put on these theta brain waves in the background, and it essentially helps to bring your body out of that sympathetic fight or flight, chronic stressed system into rest and digest, parasympathetic nervous system, where your body is more calm. So that would be my first suggestion. My second suggestion would be breath work. Again, you can get really complicated with breath work, but one of the most simple ways that I found people can do is to just do box breathing. And so that's essentially where you're inhaling for a count of 4, you hold at the top for a count of 4, and then you exhale for a count of 4. What I love about box breathing is even just doing 1 minute of box breathing. So set a timer on your phone, or, if you have a little stopwatch, 1 minute of box breathing, that's 4 to 5 cycles of going through this breathing technique, has been shown to lower that anxiety level, to bring your body out of that chronic fight or flight. I got to go, go, go. And it really does wonders to help reset you. So I know some of my clients, like if it was a crazy work meeting or a super stressful meeting, they will then kind of remove themselves after the meeting. They may go into the restroom and just practice for a minute to 2 minutes of the box breathing, and their entire rest of their afternoon is better because they have managed to help lower their blood pressure, lower their heart rate, slow everything down, and then it's going to be okay.
Yeah, because doing that box breathing actually activates your vagal nerve, right?
Yes.
And your vagus nerve is responsible for activating your parasympathetic nervous
Mm-hmm.
system. So when
Mm-hmm.
you do the box breathing, you like hack your body
Yeah.
into into that parasympathetic rest, digest, and heal. I love talking about this stuff. I have so many more questions for you, but I'm going to go ahead and just ask you to share how, if people are listening right now and thinking, "Gosh, I need to talk with this girl. I'm ready to do something about it. I can't get myself better." How can people find you? Where should they reach out to you?
I am at Basically Nourished on most platforms. So my website is basicallynourished.com, and my Instagram is at basically.nourished. I do have a cortisol management guide that is free for anyone who wants to check it out. And I go over 7 specific tips in there, or habits that you can work into your day that will help to lower your sympathetic fight or flight, chronic stressed out self, and help to just start to work some of those basic foundations in short increments into your day. So that's the best way to get a hold of me.
Yes, and I'll include all of that information in the show notes. So you guys can go ahead and download her free guide, reach out to her if you need help. Thank you so much, Krissy, for being here. It really was an honor to speak with you. I really appreciate your time.
Thank you so much for having me. I appreciate it.
Tune in next time to the next episode of Holistic Health with Melissa. Hey everyone, thank you so much for tuning in to Holistic Health with Melissa. It is such an honor to have you here. If you found value in today's episode, would you share it with a friend who might need it too, and leave us a review? If you have questions or topic suggestions, reach out on social media or visit our website, holistichealthbymelissa.com, and take care. I'll catch you on the next episode.